This is the switch here.
They want to live their lives and be able to manage their severe spasticity. They have places to go, things to do, and Medtronic intrathecal baclofen therapy may help them reach their potential.
I can put my shoes on by myself. I can bend down and tie my shoes. I'm walking, I'm running, I'm riding my bike.
I think it's important for anyone who has spasticity. They may not be aware that things could be better.
And just like you, when it comes to understanding the potential benefits of this therapy, they didn't know until they tried. Hello, I'm Dr. Don Leslie. I'm a physical medicine and rehabilitation physician, and much of my work as a caregiver and a medical researcher has been focused on helping people overcome the limitations of severe spasticity, which is a tightening and stiffening of muscles that may also involve muscle spasms. I'm here with you today because your healthcare provider believes intrathecal baclofen therapy, or ITB therapy, may be able to reduce your severe spasticity and allow you to unlock your potential. You've probably wondered, what could I do if spasticity wasn't interfering with my ability to move, relax, or get a good night's sleep? Just how much better would my life be? Today, we'll help you understand what ITB therapy is, why it has worked for so many people with severe spasticity, and what you can do to find out whether it may be right for you. It's important to remember that results may vary and side effects may occur. We'll discuss this as we go along. First, what is ITB therapy? ITB therapy has already helped thousands of people reduce their severe spasticity, particularly people who have not been able to manage their spasticity using oral medication, which can have intolerable side effects such as drowsiness, nausea, and vomiting. It has been shown to significantly reduce severe spasticity associated with cerebral palsy, multiple sclerosis, brain injury, spinal cord injury, and stroke. ITB therapy works by delivering small, precisely controlled amounts of a liquid form of baclofen directly to the spinal fluid. This is where baclofen is most effective. Unlike oral medications, which must first circulate throughout your body in your bloodstream, ITB therapy uses a surgically implanted infusion system to deliver the baclofen to the spinal fluid. As a result, the doses are much smaller than those used with oral medication, and that can minimize potential side effects.
Patients who have taken oral medications almost always have had sleepiness, difficulty concentrating, sometimes nausea from medications used for abnormal tone or spasticity. Whereas with the intrathecal baclofen therapy, because it's delivered straight to where the receptors are, it requires a much smaller dose and has less of an effect on thinking skills and alertness.
The oral baclofen, I was not able to tolerate a dosage that was doing me any good whatsoever. I'd go to sleep. I'd be sitting in a meeting, in a board meeting, and people talk around me and look over, and I'd be dozing, just flat go to sleep sitting there. Could not tolerate it at all.
So, how will you know if ITB therapy can work for you? The key step to finding out is by undergoing a screening test. It's like a test drive to see whether baclofen delivered directly into your spinal fluid may reduce your spasticity.
The screening test is a one-time event. It takes one day. What we need to do is be sure that the intrathecal baclofen will actually work for the person before we can even consider putting a pump in them.
The single purpose of this screening test is to see whether the medication used in ITB therapy can reduce your spasticity. Even a slight reduction in spasticity is considered a positive response. and many people experience a significant reduction in spasticity during this test.
Hi, Des.
In clinical
I'm
studies,
Debbie.
the test dose reduced spasticity in 97% of people with severe spasticity due to multiple sclerosis or spinal cord injury, and in 86% of those with severe spasticity due to cerebral palsy, brain injury, or stroke. The screening test usually lasts 1 day. Soon after arriving, your healthcare professional may check the movement in your arms and legs in order to assess your spasticity and your muscle tone.
One place, an area that she has quite a bit of tone is here in her plantar flexors. As you can see, I'm not able to move that foot near as far as I can move that one.
The results of this pre-test assessment will help your physician and caregivers judge how well the test dose of baclofen works. You may even be videotaped for future reference of increased improvement.
He's going to be putting the injection in this area here.
Next, your healthcare professional will use an anesthetic to numb a small area of your lower back. Then, after the anesthetic has taken effect, a small dose of liquid baclofen will be injected into the spinal fluid. A standard lumbar puncture is used to deliver the medication. You may be wondering, does it hurt? Most of my patients have reported little or no discomfort because the anesthetic is given before the dose of baclofen is delivered.
A local anesthetic, just as if you were going to the dentist or having a stitch put in, the skin is numbed up and the rest of the procedure is generally not uncomfortable. So there's the single poke and a little bit of burning from the anesthetic, and the rest of the procedure, just patient usually feels some pressure.
I experienced no pain when they gave me the test dose. There was no pain at all.
During the screening test, there is a chance you could experience temporary side effects. These may include overly loose muscles, sleepiness, nausea, vomiting, headache, or dizziness. Tell your healthcare professional if you experience any of these side effects. But remember, the drug effects during the screening tests are only temporary and usually last for a few hours. Once delivered, the test dose of baclofen may take 30 minutes to 1 hour to begin relaxing your muscles. Your healthcare professional will test your movement and muscle tone at various intervals. At the 1 hour point, you may begin to notice your muscles starting to relax.
It is. Well, it's been just over 2 hours. How you feeling so far?
Oh, good, still.
At the 2 hour point, it's common to see a measurable reduction in muscle tone and spasticity. And the 4 hour point is often the biggest indicator of whether ITB therapy may work for you. That's usually when the most significant reductions in spasticity occur.
I didn't see that. That's pretty significant. How does this compare, Des, to beforehand?
It's a lot better than it was. I mean, before I couldn't even really straighten it without clonus kicking in or some sort of spasm in the leg.
Well, it's the first time since the accident, huh?
Yeah.
Let's see you tap a few times with that foot.
And see, before there was no way I could have done that.
The real moment of when we saw the difference was when we had the trial and he could lift his left leg and cross his left leg over his right leg. He's not been able to do that since he's had the stroke.
It is important to remember the single purpose of the screening test, to see if your spasticity responds to a single test dose of baclofen. A positive response is when your muscles relax or when movement in your joints improves. It may be a slight improvement or a significant change. Either way, it's a positive response and you may be a candidate for ITB therapy. Sometimes the test dose has such a significant effect, muscles relax so completely that you temporarily cannot use them. This is also considered a positive response because the dose can be adjusted following the implant of the baclofen pump.
They may get what we call loose as a noodle, where they used to use that tone possibly to stand or even to walk. They now, with this very large dose, if they get loose, or noodly as we call it, that's a good response, that we see that they are a responder and they're a good candidate. They will not, again, be getting that large dose.
When the medication did take hold, I was not pretty loose. I was completely loose. There was nothing. I don't think I could move my legs in the bed at all. And that's how it had been when I started out. They were happy, and I was happy too, because that's what I wanted. I wanted it to work.
The screening test is just one injection, one jolt of medication which tells us yes or no, the therapy will work for you. And the actual implant or the actual pump gives us the ability to play with the dose and make it exact for that patient, for what they want to be able to do with their body.
There is the chance that your test dose will not decrease your spasticity. If that happens, your healthcare provider may still believe that it may work and may choose to have you come in for another screening on a different day, using a larger test dose to see whether you respond favorably.
Yeah, clearance of your right foot is definitely better than when I saw you in inpatient.
Yeah, big difference with the foot not dragging no more and the shaking and burning.
The effects of the test dose usually last 4 to 8 hours. Then as the medication wears off, your spasticity will gradually return to where it was before the test started.
A lot of people do complain when the dose wears off. They want it to keep feeling like that forever. And so they're usually very eager at that point to go on to implant and eager to get the device to see how it's going to work for them.
If you respond favorably to a test dose of liquid baclofen, you may benefit long-term from ITV therapy. It works by using a small, programmable pump, which physicians place under the skin of the abdomen. They then place a small, flexible catheter, which leads from the pump to the spinal fluid. Liquid baclofen, called Lioresal intrathecal, is then delivered from the pump into the spinal fluid in small, continuous doses. You may be wondering whether the pump will stick out and be noticeable.
It's noticeable in a bathing suit or when there's no clothes on, but generally it's not noticeable with the clothes on.
It's just under the skin in your abdomen, and it doesn't really show much. It does some, and I know I'm pretty thin, so it doesn't stick out a huge amount. I mean, it does show some, but under clothes you really can't tell.
Hi, Mr. Morris. How are you?
Hello, Pam. How are you?
Good.
The pump will need to be refilled every 1 to 3 months, depending upon the size of your dose. This is done in your physician's office in what may be a 10 to 20-minute visit.
To do a refill, we access the pump just straight through the skin with a needle. We're just a little bit of a stick through the skin, and at that point we hit the pump immediately, and that's really all they feel. It goes straight into the pump, and we're able to refill just straight through their skin.
Your healthcare provider can easily adjust the flow of medication using an external computer programmer.
The muscle spasms have been reduced, and really every once in a while they'll flare up a little bit, but if they do, I can go in, have the pump turned up to where it delivers more medication, and they'll calm down again.
Having control like this really gives us a good way to make life as perfect as we can for the person with spasticity. So we're able to play with that dose, treat that patient as an individual, and really work on what's happening with them. So we can get very precise and make things as good as we can for that individual.
There are some common questions that people have based upon their individual situations. People with multiple sclerosis may wonder, could surgery exacerbate my MS? While any kind of stress like surgery has the possibility of causing difficulties for MS patients, your health care professional will take steps to minimize any risk.
We generally have patients with multiple sclerosis come to our acute rehabilitation unit as soon as possible after the surgery to minimize the amount of time that they're down in bed. They often receive local anesthetic instead of general anesthetic in order for their entire surgical stress to be lessened. And we do advocate getting them up as fast as we can so that they're not lying in bed getting deconditioned.
Others may ask, can a person with